Greetings, everyone. If many of you are following me from ChitChat with Gloria, Injustices of Hispanics Part 1, you know who I am. But if not, my name is Gloria Martinez Osornia. Please, if you have not watched Part 1, do so. This will make much more sense. Welcome to ChitChat with Gloria Part 2. Injustices of Hispanics impact their mental health and stability. I'm going to do a little overview of Part 1 to set the mood for the second part. In Part 1, I discuss some background information about how my family's American dream began. I spoke about how my father was going back and forth between the United States and Mexico because he was not stable enough to bring my mother and sister with him when he first came to the United States. I addressed the injustices my father faced and the fears that overwhelmed him and my mother. This is because he was undocumented, driving with no license, and trying to support his family by working. The fear of deportation was a battle we faced daily and continue to face because my parents are not documented still. Not to mention, the biggest battle was the language barrier. My parents do not speak English and their first language is Spanish. Until now, my father can speak what he calls street English, which is broken English he's learned while working. My parents can understand English, but my father can somewhat speak English while my mother cannot. In addition, I also spoke about the injustices my sister faced when she entered elementary school. Here, shortly after, my father brought my mother and her with him permanently to live in the United States. She faced so many hurdles, like not being able to complete her homework and my mother not being able to help her because it was a completely different language. She faced discrimination because of her skin color being too brown or too dark. They would bully her about having curly hair and being a darker skin complexion. I can remember the amount of stress and how heartbroken my mother would be to see this happen to my sister. My mother would not do much about the bullying since she could not communicate with anyone at my sister's school at that time, since they did not have translators. However, one thing I can remember is how my mom found a neighbor that would help my sister with her homework and practice her English. This was amazing. Just listening to this brief overview of Part 1, doesn't this highlight dysfunctional stability and mental health problems? Of course, it does, and it's sad. This causes a severe amount of trauma. Therefore, it is very important for me to bring awareness and be here today, discussing the mental health and stability of Hispanics and Latino community. Have you ever heard people joking about Hispanics and Latinos being 5 years old, reading legal documents to their parents? Well, it turns out this is not actually a joke. This is reality. Hispanics and Latinos have to grow up at a young age to get their parents through situations like what I described about my own parents. I was one of the children who had to grow up at an age of 10 years old when my sister left us to go back to Mexico to continue her education. According to Rhodes and his colleagues in the American Journal article, The Impact of Legal Immigration Enforcement Policies on the Health of Immigrant Hispanic Latinos in the United States, their study presents a graphic of how immigration enforcement policies impact Hispanic and Latinos' access to and the use of public health resources. For the most part, the most common health care services that Hispanics do not get adequate medical assistance is prenatal care and treatment for sexually transmitted diseases. Hispanics frequently avoid utilizing health care services for which they are eligible because they worry about being discriminated against and deported. Additionally, I believe that a major factor in why Hispanics and Latinos do not utilize tools is a lack of awareness. Hispanics frequently lack knowledge. In the same way, Lovato and Abrams wrote in their article, An Examination of Latino Immigrant Families' Social Service Needs Following a Deportation-Related Family Separation, addressed the variety of access and usage obstacles to psychosocial and medical resources affect immigrant families. Immigrants report to experience discrimination in healthcare environments due to their race, ethnic background, insurance status, and limited English proficiency, according to Keller and coworkers. Not only that, but Latinos discuss that they fear being discovered by immigration based on services they apply or get approved for. In a way, they feel mistrust from the service providers that they will report them to immigration officers. Lovato and Abrams highlight how Latinos and Hispanic families are negatively affected by deportation of a parent. When there is a situation of deportation-related family separation, this causes a gap in their life, which affects them tremendously. One specific thing mentioned is that students go to school less prepared, little to no school supplies, and even missed meals. Let me ask this question. Does this sound human to everyone? Forcing a family to separate, causing anxiety, stress, and mental health issues, while this ethnicity seeks little to no healthcare services? Can this be applied to all ethnic groups? Yes and no. I don't think so. Because I do understand that all ethnicity groups go through some type of discrimination or traumas, but nothing compared to what Hispanics and Latinos go to. Try putting yourself in these people's shoes. Lovato and Abrams mentions how some Hispanic parents are not involved in school for their children, because since this is a public government institution, ICE can arrest them, so they avoid it. Ornell and his colleagues' article, The Health of Undocumented Latino Immigrants, What We Know and Future Directions, address that in comparison to their documented counterparts, undocumented immigrants who live in environments where they fear deportation because of restrictive policies are less likely to access health services, less able to follow medical professionals' recommendations, and more likely to experience depressive symptoms and anxiety. This can eventually lead to social isolation and economic uncertainty. Recent studies have revealed that drug abuse, depression, anxiety, and post-traumatic stress disorders are the most prevalent mental health issues. According to Torres and other colleagues in the article, Immigration Policy, Practices, and Procedures, the impact on the mental health of Mexican and Central American youth and families address the stages of migration which involve trauma. The article provides insight that before migration, some people can experience traumas. People can experience traumas while migrating. And third, traumas from hostile environments in a new country. When you break it down this way, it makes more sense, especially for Central American people who are fleeing their home of origin because of government policies and seeking a better life. Not only that, but Mexicans can also experience traumatic experiences dealing with gun violence, cartels, and economic insecurity. Have y'all ever heard the border is hot? It's not literally hot, but they refer to the homicide rates and the gang violence. Wouldn't you be traumatized or experience mental health issues after living through certain things like the ones mentioned? Other traumas such as physical and sexual abuse and witnessing crime, and much more. I know I would. Just reading these examples on the article brings chills to my body. These are the kind of traumas families experience before migration. Yet coming to the new country to experience more experiences make me feel even worse. The article talks about the unaccompanied children coming from Central America at the border and that this has increased in the last 5 years. Patrols and officials detain these children and put them through trial on their own with no legal support and in a completely different language. These people are violating the children's rights and putting them through traumatic experiences that they will always remember. Also, these unaccompanied children are fleeing their country to seek help, but end up not qualifying for assistance or services to help them cope with these traumatic experiences. They are running away because they are undocumented. How can you call this being humane? How can the world we live in be called having equal rights when we have undocumented minors fleeing their country to seek assistance and they can only have access to public education and unsanitary living conditions? This is disgusting, and the deeper I dig, the more disgusted I am to see how this world is completely trash. How can the United States say that they offer opportunities when we have undocumented people migrating to the United States to seek a better life, and nothing is being offered to legalize these individuals, but also not providing them with proper psychological help they require? The Latinos and Hispanic communities are being significantly damaged and at high risk of depression, stress, maladaptive family functioning, and poor mental health. In the same way, the psychological impact of immigration status on undocumented Latino women. Recommendations for mental health providers, written by Lucila Ramos Sanchez at Santa Clara University, express theoretical evidence of deportation on undocumented individuals. For example, the text describes how most people, when getting deported to their home country, are detained at detention centers for a hearing in terrible conditions that can lead to death. The article highlights how this is due to poor hygiene, poor sanitation, and inadequate nutrition. The article even describes how the food seemed to be moldy and expired. Are these adequate living conditions for a human? No, they're not. This is not only discrimination and injustice that these people's rights are being violated and treated like animals because they're not being treated like human beings, while also not having proper medical care and sexual abuse and harassment. Once more, everything boils down to how these people's suffering affects their mental health and emotional distress. One might anticipate an increase in psychological trauma and other mental illnesses amongst undocumented Latino women based on recent results and previously described psychosocial factors. These people are at high risk of depression because of family separation. Other psychological distress involves anger, fear, and frustration, according to Lucila. According to the book, The American Latino Psychodynamic Perspective on Culture and Mental Health Issues, Salman and Solange Margery state that since the Hispanics and Latino population is one of the largest ethnicity groups, they go through a lot. The book mentions acculturation stress, from the pressure to assimilate discrimination, the loss of beliefs and values, loss of social support like family. This is common because the Latinos and Hispanic people migrate to the United States typically alone. They leave behind their parents and their siblings. In these situations, immigrant parents take longer to adjust to the new cultural environment, in part because of greater enculturation and social isolation, difficulty learning the language, anxiety about their changing parenting expectations, and their children's loss of cultural identity. This is another reason why Latinos and Hispanics are reported to have a higher number of teen pregnancies as well as a higher risk of sexual transmitted diseases, according to the article written by Salman and Solange. The article, Factors Affecting Mental Health Service Utilization Amongst Latino Americans with Mental Health Issues, written by Chang and Beagle, found that the Latinos and Hispanics with no health insurance are less likely to access mental health services, which means that they require assistance. In addition, Latinos and Hispanics already do not adhere to healthcare services, let alone if they have to pay for them. The article addresses the need for education for the Latino and Hispanic community to bring awareness to their needs for mental health care. We need better laws and regulations that will help the financial discrepancy to access services for this ethnicity group. In the article, The Mental Health of Hispanic and Latino Americans Following National Immigration Policy Changes, written by Emil and Aron, they found that more than a third of Hispanic respondents, which is about 34.8%, reported at least one poor mental health day in the preceding month, and 11.38% reported frequently mental distress. The article even found that Hispanic and Latino Americans' mental health worsened more in states with larger increase in arrest rates. Once again, all this information presented today is all correlating with the the traumas and mental health issues caused by laws and regulations implemented against the Latino and Hispanic community. Garnisi and Associates state in Anti-Immigration Policy and Mental Health, Risk of Distress and Traumas Among Deferred Action for Childhood Arrivals Recipients in the United States found high clinical levels of distress and a particularly high prevalence for DACA recipients. In other words, they found a strong association between immigration legal status and distress amongst individuals of the Hispanic community. The author even states that they are at highest risk for psychological distress due to trauma and discrimination related to anti-immigrant sentiment. This does not shock me for the amount of overlap I found when researching this topic. This is revealing a public health crisis for the Latino and Hispanic individuals. According to the National Center of Biotechnology Information, they concluded in perceived discrimination and depressive symptoms amongst U.S. Latinos, the modifying role of educational attainment. The study is the first to discover a relationship between prejudices and indifferences and depression. Symptoms according to the educational level. In other words, as Latinos reach higher education or economic settings where they might lack social support as a minority, higher education levels may reflect increased chances for exposure to racism and discrimination. Can we please see that this issue with the world we live in? If the Latinos and Hispanic community grows in the United States, it's a problem. And if they don't, it's also a problem. Can we bring more attention and awareness to the psychological distress, traumas, and depression this country is causing the Latino Hispanic community? The most crazy thing about this is that Hispanics come into the United States for better opportunities, but instead get discriminated and treated unfair. Their rights are being violated. Everything I just reported is an overlap of information that is not a new topic, but instead is something that is always overlooked or overseen. For this exact reason, I wanted to speak about it, because I come from Hispanic roots. My parents are Mexican. I have experienced some of these traumas myself. Although my family has went through the traumas, some of these things I still feel what they feel as well. And now with me today, once again, Miss Pico.
Yes, good morning. I mean that this is my name is Anna. I don't know if you remember me from the last time when I had the previous interview about
the laws and regulations.
Laws and regulation. I'm so sorry.
And the injustices.
Yes. Okay. I mean, I'm ready for your question, Miss Gloria.
Is there a story you would like to share with us about a traumatic experience while coming to the United States?
Yes, actually, I mean that there is. I mean that when I remember when I was that time. I mean that it was a week that I spent in the border. There is I mean that I was able to see a lot of guns violence. It's very dangerous. I mean that people from the cartel they're really trying to. I mean that get the women and all the women they get sexually abused. I mean that even the children. I mean that they try to remove the children from the parents and sell it to other people.
For drugs, right?
Yes, for drugs. Yes, and also I mean the people that are going from the U.S. they are going to the border. I mean that they just tell us. I mean that go back to your country because you doesn't belong here. I mean that and it's hard because I mean that when you come to this country, you're just trying to just have an opportunity to be better, and you don't do this only for you. You're trying to do the best for your childrens.
What is your opinion on laws and regulations affecting the mental health and stability of the Hispanic and Latino community?
Um, in my case, I mean that it's really affecting the children with a lot of traumas. I mean that when they go to the school, I mean that sometimes they feel afraid to go back to the school because I mean that they feel that they doesn't belong to that place. It's a lot of depression, and
so in a way, the students are afraid to go to school.
Yes.
Because they believe that their parents won't be at
or
home.
They're not going to see the parents again because they're going to be removed or taken away from them.
And how does that make you feel?
Oh, it's really hard. I mean that you know how hard it is that you could leave your kids and I mean that be crying every day because I mean that it's really hard. I mean that for the children, I mean that to live with this situation.
It's traumatic. What are some ways you think we can improve and help the Latino and Hispanic ethnicity to get through the situations they experience and their traumas?
I think so. The amnestia. I mean, that's something that really help. I mean, because we really, I mean, that we are not criminals. We really come to this country to work. I mean that, and we are here just not to take. I mean, the other people's job because everybody works and everybody deserve. I mean, to be something good and be good for the community.
So you think we should have like a program that will help immigrants get their residency or at least be legalized here in the United
Exactly.
States?
Yes.
Okay. What about any prevention programs to help them with their traumas and
That's the most needed because it really since the beginning. I mean that this is. I mean that it should be something done since we are. I mean that at the other side, uh, pr- get these programs to really assist everybody, children's parents, mothers, so they're going to be able to. I mean that be prepared to for the future. Let's say for the future world to come at this country.
I agree. We need psychological help and mental health programs for these children and these families. Is there anything else you would like to share with us today?
I mean, that I just say that I'm just really happy for this opportunity that you are giving me to provide this information to other people, and they're really so they're going to be aware what we're really going through.
And I completely understand because I feel like nobody really understands how the Latino and Hispanic communities are affected. I do understand that all ethnicities go through stuff, but I feel like it's nothing compared to what we go through.
Yes, it's hard. I mean that when other people are at the other side, and then when we are suffering, I mean that because we really suffering this, it's really affecting, and it hurt. It really hurt
I can see
our
it in your
families.
face.
Thank you.
Well, this is it for today, and I want to appreciate everybody for giving us the time once again to listen and address this issue all together. And I thank everyone for your time and attention, but especially you, Miss Anna.
Oh, thank you, Miss Gloria.
Thank you. Have a nice day.